morning, and welcome to UHD's third COVID-19 Vaccine Information Forum. My name is David Bradley, and I serve as the Vice President for Administration and Finance here at UH Downtown. I'm very glad to be here today to MC this session as part of our on-campus conversation, or ongoing campus conversation related to COVID-19. As we prepare to repopulate our campus, we know there are questions about health and safety and about the COVID-19 vaccines that have recently become available to all adults. This series is the vision of President Blanchard in an effort to share information with our university community about COVID-19 health and safety practices, the vaccines, and to help answer questions our community may have. We're finding in these first few weeks with Dr. Blanchard that he is very much a person of action. These forums are about one example of that. Upon arrival, he moved quickly to have UHD serve as a vaccination site. A week ago today, in partnership with Methodist Hospital, just under 500 members of the UHD extended family, including alumni and retirees, were able to come to campus to receive their shot. Methodist Hospital was so pleased that they are eager to do more of these vaccine sessions, and plans are underway to do that. At Dr. Blanchard's direction, we are also moving to bring rapid COVID testing to campus, which should be available by June 1st. So, a lot going on. Let me get to our distinguished guest. Joining President Blanchard today as our medical expert is Dr. Stephen J. Spann. Dr. Spann, a family physician leader, educator, and researcher, is the founding dean of the UH College of Medicine and serves as the vice president for medical affairs at the University of Houston. Spann has dedicated his career to improving health and healthcare around the world by training future healthcare professionals and contributing to the scientific knowledge base of primary care medicine. I have a listing of the various commissions and boards on which Dr. Spann has served over the years. I'm not going to read that, but believe me when I say that it is extensive and impressive. Dr. Spann has served as a consultant to medical schools, residency programs, ministries of health, and healthcare delivery systems in many countries, including from 2012 to 2015 when he served as the chief medical officer of a 460-bed teaching hospital in the United Arab Emirates, managed by Johns Hopkins Medicine International. Earlier in his career, Dr. Spann served as chairman of the Department of Family and Community Medicine at Baylor College of Medicine, and during that time, he also served as Baylor's senior vice president and dean of clinical affairs. Before joining Baylor, Spann spent time at the University of Texas Medical Branch at Galveston, the University of Oklahoma College of Medicine, and the Wake Forest Bowman Gray School of Medicine. Prior to entering full-time academic medicine, Dr. Spann spent 4 years practicing rural family medicine in Arkansas and North Carolina. Dr. Spann is a graduate of Baylor University and the Baylor College of Medicine, which means that he was probably pretty happy when the Baylor basketball team thumped our Cougars a couple weeks ago, and then Gonzaga on their way to the national championship. Although he probably has to be very careful to conceal his happiness while around Dr. Couture. Dr. Spann completed his residency training in family medicine at Duke University Medical Center, and somewhere along the way, he found time to earn an MBA from the University of Texas at Dallas. Before I turn it over to Drs. Blanchard and Spann, I would like to remind the viewers they can ask questions via the Q&A button at the bottom of the screen, and I promise we will get to a few of those before the session is through. With that, I will now turn it over to Dr. Blanchard.
Thank you so much, Mr. Bradley. I really appreciate your serving as facilitator for our third and I think perhaps most interesting session to make sure that we're building public awareness of all that we're doing to ensure that our campus will be safe and healthy by the return of the fall semester. I also would like to just take a quick moment behind the scenes to thank Dr. Liza Alonso as well as Mr. Richard Vera for all the work that they're doing to make sure that these forums run as smoothly as possible. I think we've got a great treat here today to have Dr. Spann join us, frankly, as a member of the University of Houston family, to be here to not only answer questions more generally that we have received, Dr. Spann, from our faculty, staff, and students, but also really honing in as well on what should be the best practices relative to what we know here at the University of Houston. And this will be the first time the first two panelists have been just fantastic in terms of their responses. This one is different because, as I said, you're a member of us at UH. And so we've got a few questions that will be specific to UH as well. I'll jump right in with the questions because we've got a number of them that have come in since the last forum that we've held. And the first one is a standard one that we've asked the other two panelists, or experts, I should say, and that certainly we'll ask of you as well. And that's just to give us an overview of your sense of the current COVID-19 conditions in the city, your view on the future, and what role will vaccines continue to play here in the city of Houston and the state of Texas.
Well, thank you very much, President Blanchard, for the opportunity. It is a joy to be with you today. And, you know, as a professor, I like to use slides. So I'm going to see if we can make the slides work here because
Fantastic.
I want to show some data to answer the question. Now, are you seeing these well?
I can see it perfectly. Thank you.
Great, fantastic. So just to provide some up-to-date data on where we are with the COVID pandemic here in our state and then locally, this is data from our Department of State Health Services, hot off the press. This was yesterday's data. And what you can see in the upper graph here is the running daily number of new cases of COVID in our state over the past really over a year now. And then the solid line is the running 7-day average. So you can see here that you know, we're at a much better place than we were. And we're pretty well plateaued in terms of new cases per day. The third curve is the new fatalities, daily fatalities. As you can see, that has continued to drop as well. So that is really good news. Now let's come down to our county. This is the same data for Harris County, and again, you can see that we've plateaued at a relatively low level. We'd like to see it come on down, and I think it will. And again, fatalities improving. This is data on hospitalization. This is a total number of COVID-19 hospitalizations on a daily basis over more than a year in our state. And you can see that, again, those numbers have come down nicely. And this then drills down to Harris County. The blue line is the total number of COVID in general hospital beds in our region. And then the purple line is COVID ICU beds. And what you can see here is that these have come down and are staying down nicely and are actually right at or below a threshold for what is considered to be safe. This curve shows us the positivity rate at a state level on a 7-day running average. And what you can see here is that the percentage of positive tests around the state is now almost down to 5%, which is really great. I mean, it's been as high as 20+%. And then if we hone down to our Harris County, we're not quite as good. We're running closer to 10% in the county, but it has improved nonetheless. The final slide that I want to share is a slide that shows us some data on vaccine penetration in our state, but specifically in our county. And what you can see here is that in Harris County, if you look at our population 16 years of age and older, around 49% have had at least one dose, and about 32% of that population is fully immunized against the disease. If you look at our population 65 and older, 77% have received at least one dose, and 62% are fully vaccinated. So those are really encouraging numbers. And am optimistic that as we continue to get an increasing number of our population immunized, we're going to see those new case rates and, of course, case fatality rates go down. So I have an optimistic outlook here and believe that things will continue to improve.
Well, certainly, even thank you for that. And those data points are really important for us to have before us and to really understand the level of progress that we're making on the vaccination front. And we know clearly that those that are 16 and older, that we're seeing steady progress there. Although I should say that we're hearing more nationally that there's more of a standstill now, that we're not seeing as many adults that are coming forward to take advantage of the vaccinations. I'd like for you to talk about that, if you don't mind, in terms of, is this normal? When we have a public health crisis like this, do you normally see that there's a decreased number of individuals who are coming forward in order to reach a higher level? Or is this perhaps more specific to what happened with the Johnson & Johnson vaccine, that it somehow placed a sense of fear in people and that they're not moving forward with the vaccination? Your thoughts?
Well, that's a great question. We have known that there are people out there that are hesitant, right? They have concerns. Some folks are concerned, for example, that not enough time has passed to know whether there are going to be major side effects to the vaccine. But the fact is that side effects to vaccines typically will show up within 6 weeks to 2 months of their receipt, and we're now way past that. We're several months into vaccinating folks. Some people are worried that it will affect fertility, and again, there's no evidence whatsoever about that. There are a lot of misconceptions and myths out there about the vaccine. I think the Johnson & Johnson pause last week did probably increase the apprehension a little bit because there were some serious side effects at a very low incidence, less than 1 per 500,000. And these were mostly in younger women. The new guidance suggests that perhaps younger women should receive one of the other vaccines. I think there are some other challenges to some people getting vaccinated. Sometimes it's just getting an appointment. Now, those have become much more abundant now because the supply is exceeding the demand. Some folks have had challenges making their appointments online. Maybe they don't have internet connectivity. But we're hoping that those are going to be overcome. There is a need to get the vaccines out into the communities, and we know that certain communities have a lower vaccination rate. Communities of color, for example. So we need to find ways to educate these communities to help people feel comfortable with the safety of the vaccines and their efficacy. And then get those to where people are so that we can increase the vaccination rate and ultimately get to herd immunity.
So in keeping with that statement, just this morning when I was watching the news, when I was getting ready to come here to work, that in other cities, they're beginning the process of mobile vaccination units and moving them into communities, just as you described, where people have not predominantly been coming forward and taking advantage of it. Are you hearing any of that happening here in Harris County by chance?
Well, we're certainly having conversations about that. The president last night said in his State of the Union address that essentially every American could now get a vaccine within 5 miles of their house. That may be too great a distance. So we're working with our city health department, thinking about how to get vaccines out into the community, be it by going to community churches and other kinds of agencies, whether it be mobile vans, whether it be house calls to folks who just can't get out. Maybe they're not mobile.
Mhm.
I think we have to find ways to get the vaccine to where the people are so that we can increase the vaccination rate.
I can say to you that a number of our listeners here today are also parents, right? You know, they're faculty and staff and students who are parents.
Yes.
And I know you know where I'm going with this question. So they're very concerned about when will be the time frame that we can expect the vaccination to be available to children. Any thoughts on that?
Great question. And yes, it is a concern and it is a priority. Pfizer has already completed, I believe, their clinical trial in young people ages 12 to 15, I believe. My understanding is that they will be seeking an emergency use authorization from FDA in the near future. So it may well be that group of young people will be eligible for vaccination late summer, early fall. I think for the younger children, the trials are still in process, and that may be end of the year before we see vaccine availability for kids, say 6 months and above. But hopefully we'll get there by the end of the year. I think that will go a long way towards, of course, mitigating parental concerns, which are legitimate, and also towards increasing our herd immunity.
You mentioned about the FDA approval side, and which then brings to mind the fact that certainly within the past week or so, we're starting to learn that more and more public universities and university systems are planning to require vaccinations. And that becomes a point of confusion for a number of people, because the thinking is that under the current emergency use authorization, that it's very difficult to move forward with such a requirement until there is FDA approval. Do these higher education enterprises, the public ones as well as the private ones, are they subject to having some information in front of them that suggests that this FDA approval is just about done and will be here relatively soon?
You know, that's a great question. I don't know the answer to that. I'm not sure when the FDA approval will come, although we're hopeful that it will be relatively soon. And I think some of these decisions are based on legal interpretation, and then some of these decisions are based on political realities. I was fascinated to notice or to read that the former university system that you were the university system that you were formerly associated with is going to be requiring that in the fall. Fascinating situation. I think where we are in Texas right now, we will not be able to do that due to the governor's mandate that we would not require vaccine passports in our state. But it'll be interesting to watch the evolution of that.
Mm-hmm. I want to point out that in the fine print that is not being advertised in the national news for California State University in terms of their recent announcement, it says in there very clearly, although in fine print, that it'll be based upon FDA approval.
Okay, excellent. I didn't know that. That's fascinating.
Whenever that will occur.
Right. Hopefully.
So you talk about herd immunity, and that is one of the questions that's lingering in the minds of some of our faculty and staff. When do you think we will obtain herd immunity for COVID-19?
Well, you know, a lot of folks had hoped that we would be there by the end of summer. We define herd immunity as having somewhere between 70 to 85% of the population immunized. And that's important because when you get that rate of immunization, it's much less likely that people will become infected from other individuals. I don't think we'll be there by end of summer. I'm hopeful that we'll be close. I would hope, though, that by early next year we would be there. Certainly, if we can get the kids, the children, adolescents immunized, that will help. I would be surprised if we get there by end of summer, but I'd be pleasantly surprised. It'd be great.
Yes, we all would be.
For sure.
So as well, we're hearing more and more in the news about the potential for boosters. And just wondering your sense of once vaccinated, what is the estimation of time of how long the vaccination will actually last, or how long it will be effective? And do you think that there will be a need for boosters? And if so, at what time frame do you think that we'll be moving in that direction?
That's a great question. I don't think we know the exact answer. We've been following people who have been immunized long enough now that we're confident that the immunity lasts for at least 6 months. I think a lot of experts believe that will ultimately be closer to a year before the immunity begins to wane. I think most of our vaccine experts do believe that we will need boosters. I noticed yesterday in the press that Pfizer was preparing a booster and thinking that, that might need to be offered as early as end of year, early next year. So there are two reasons for boosters. One is that if the immunity wanes, you just want to give a booster to boost that. Mm-hmm. But the reason we take annual flu shots is that actually there are genomic mutations that take place in the flu virus, and we know that's happening, of course, in the coronavirus because we're seeing these variants come about. And so it may well be that in the future we will take a quote booster that also incorporates immunity against the new variants as they develop. So I'm guessing that we probably will need a booster, probably end of year, early next year, and it may well become a yearly event.
So when you speak of the variants, I mean, again, another topic that's often in the news. And so one of our staff members has asked the question of how well does the COVID-19 vaccine protect us against the various variants that have made their way to even our local area? And how likely are we to continue to see new variants arrive?
Great question. And there are a number of variants, and new variants are being identified with frequency. And we know that we have some variants, particularly the UK variant, prevalent in our own area now. What we know about these variants is that most of them seem to be more infectious. There's a higher infectivity rate, a higher risk of getting infected if you're in contact with someone with COVID-19. We also know that some of them seem to be more virulent. They cause more serious disease, more probability of becoming seriously ill and requiring hospitalization. The jury is still out on the efficacy or effectiveness of the vaccines against those. Some experimental data, some what we call in vitro, meaning in the lab, in the test tube data, suggests that for some of these variants, the vaccine may not be as effective. I don't think we yet have the epidemiologic data to confirm that, but that is certainly a concern. As long as we have people transmitting the infection, that gives the opportunity for the virus to mutate. And so as long as we have spread of disease, we are going to see new mutations, new variants. This is the reason why we all need to get vaccinated, because once we are able to really minimize transmission, then the opportunity for mutation and new variants will decrease. So it's just, it again calls us to really try to get our population immunized.
Let's shift away just a bit from vaccinations and let's move more toward preparing for the new academic year. And you've heard both Mr. Bradley state, as well as I stated earlier, that we're working very aggressively to make sure that our campus community will be as safe and healthy as we possibly can make it. And I know that the University of Houston campus is doing the same. So as we look ahead to the fall semester, and really for the summer, but mainly for the fall semester, and prepare for a more robust campus life, what precautions do you think are most important? how do we really safely repopulate the UHD campus from your perspective there at the University of Houston?
Yeah, that's a very important question. And I must tell you that I have spent a lot of my time over the past year thinking about prevention and control on the campus. And I've learned a lot, and it's been fun. And I think that we've had the pretty good success in terms of really minimizing transmission. I would say that there are various things. And first of all, we have to keep our eye on the pandemic. If there is a surge, if there is another surge, then we would need to slow that sort of reintegration and return to campus down. But assuming that we continue where we are and hopefully continue to get better, what can we do to really minimize risk of transmission and infectivity? I would put at the top of the list everyone getting vaccinated. I think that is the strongest strategy. I think that is the best strategy. And it's not just about protecting ourselves, it's about protecting our community, right? By getting herd immunity among our UH communities.
Mm-hmm.
The second is the public health measures that we've had in place. Social distancing, mask wearing, still very important to prevent the transmission of the virus through aerosol. Hand hygiene, hand washing, and then respiratory hygiene, of course, are important. So I think it's continuing what we have been doing and continuing to do that well as getting everyone vaccinated.
In that same vein, what advice would you offer to faculty, students, staff who are really worried about coming back either to engage in the classroom or to be in their offices? What would be the advice that you would provide?
Well, I think my first advice would be concerned, be alert, be careful, but don't be afraid. The truth is that I think the leaders on our campuses are being very, very careful, or staying on top of the epidemiologic data, the CDC guidance, and we're not going to ask folks to do something that is of significant risk. We're going to do everything we can to minimize the risk of infection. We can't make it zero, but we can do a lot to really minimize it. Get vaccinated. That is key. And then, pay attention to the public health maneuvers. Wear those masks. Keep those 6 feet of social distance. Do good hand washing. Respiratory hygiene. All those are very important. But I think there needs to be confidence that if there is a shift in the epidemiology, if there is a surge, we'll rethink these things. And our number one goal is to protect and take care of our communities.
Mm-hmm. Couldn't agree more, and especially in terms of the latter point that you made, that obviously if we see a surge, this is what we had to do in spring of 2019, right? It was definitely pivoting on a dime in order to move into virtual education. This go around, we have more information, would have more time, would have more information to really be as prepared as possible if there is such a need for us to go back to the fuller virtual education. So that's a really good point that I'm happy that you made. Again, looking ahead for fall preparations, how important will ongoing testing and vaccines opportunities be for college campuses such as ours?
Well, I think important. Now, the good news is that vaccination is becoming very, very accessible. And so, do we need to have the ability for people to get vaccinated every day on campus? Maybe, maybe not. It's a challenge because most of the folks doing the vaccination want to vaccinate large numbers of people. Mm-hmm. But access to vaccine is important, and encouraging people to get vaccinated is important. I believe that the need to have testing on campus is still important. we've noticed a decrease in the utilization of our on-campus free testing program, which is um, interesting. And when people get vaccinated, there should not be really a need for testing unless one becomes symptomatic. But as long as there are folks out there who have not received vaccine, I think having the ability to get tested, certainly when you're symptomatic, ideally even when you're asymptomatic, would be helpful. It'll be interesting to see how long we're able to do that. I think that as more people become vaccinated, the demand decreases, then the ability to offer daily free vaccine testing may be compromised.
I want to remind our audience that if you have questions, feel free to send them in to us electronically, and Mr. Bradley is monitoring those now and will be raising those relatively soon. So feel free, if there are any follow-up questions based on the information that you're learning right now that you'd like more information on, feel free to send those to us. So I know as well, Dr. Spann, that certainly on our campus, and I'm sure your campus as well, that summers not only is designed for our students to come and take advantage of summer classes and have our faculty and staff here, but oftentimes we offer summer programs, and those summer programs are for youth, right? So do you have any advice for running in-person programming for children during the summer? Is this advisable? Are there special considerations that we should make, or safety precautions when working with younger people and having them here during the summer, this summer in particular?
You know, I have not seen any recent CDC guidance on whether one should avoid those programs or not, but I'm aware that people are having summer programs, and we know what the guidance is in terms of trying to prevent COVID transmission. And it's the same public health maneuvers, wearing the mask, and children do pretty well with this, and those who are currently going to school in person are used to that. Hand hygiene, social distancing, although the latest recommendation on children in school is it can be 3 feet as opposed to 6 feet of social distancing if they're masked, and of course respiratory hygiene. So I think that in the cases where we do have summer programs, just really emphasizing those prevention measures is the way to go.
So in terms of that 3 feet versus 6 feet in terms of social distancing or physical distancing, especially within the classroom, right now we know that it's 3 feet at the K-12 level. Do you have any sense that that's going to become the standard and would be applicable to higher education as well?
That's a really good question. I've not seen anything written about that so far. And I think that the reason that for younger children it is less is probably because they don't, due to their size, although this is different, I guess, for high school kids, but they probably don't speak as loud or yell as loud and propel the aerosol forward. I don't know where that will go. It would be good. It would be great if it could reduce. It would give us the ability to have more of our college students in one classroom.
So another area of focus for us is international travel. And just wondering if you've got any perspective on when you think that we might begin to engage in international travel again, especially as it relates to our study abroad programs, as well as faculty who engage in international research. Any idea about when we might be able to resume these activities?
Well, the CDC has said that for folks who are vaccinated, it is relatively safe to travel domestically. I use the word relatively on purpose because, again, it's not absolutely safe. But they are less reassuring about international travel. I think in part because the vaccination rate in other countries, in many other countries, is not nearly as high, and CDC now has a rating by country in terms of risk. I looked at that last night, and most of the countries around the world, including ours, they rank at a high risk. They don't say you cannot travel internationally, and in fact, the new recommendations say that if you do choose to travel internationally, you don't necessarily have to be tested before you travel unless that's required by your host country, but they will require a negative COVID test before you board the airplane to come home. So I think the answer to the question is international travel is probably riskier than domestic travel, and one has to weigh the risk versus the need or benefit for that travel.
So I'll ask one final question before I turn it over to David, because I'm sure that the audience members have piped in with a few questions as follow-up to what we've talked about thus far. But where do you recommend? So we've been doing these forums and really designed to, as you can hear, these questions are very thoughtful and they are what's on people's minds right now. And obviously we're going to continue to do these as often as we can. But if you had to recommend to faculty, staff, students, where can they go independently to get the most current information on COVID-19 and vaccines? What are some good sources that you would recommend?
Well, I think the CDC website is very good. And you know, we based all of our protocols here at UH Central on CDC guidance. So I really trust CDC. I think it's scientifically based, evidence-based. So I would recommend that. In terms of the data, the Texas Department of State Health Services has a great web page and dashboard that provides up-to-date data. Our Harris County Health Department, Harris County Public Health, in combination with our City Health Department, have a great web page that provides up-to-date data. There is a Texas Medical Center COVID dashboard, which also provides information. So those are the kind of places that I go, and then I try to keep up with what's in the media and as well as the medical publications. But I think the CDC is sort of the gold standard.
Mm-hmm. I can't thank you enough for the information thus far, and I know that I'm going to circle back to you before we end our session today. But I just would not miss the opportunity to tell you just how helpful this information has been. And I know that I certainly appreciate it. And I know that the UHD community at large appreciates you as well. So thank you. I'll turn it back over now to David and Mr. Bradley, who can raise a few more questions that he has learned since we have begun our session here today. Mr. Bradley.
Yes, sir. We do have questions coming through. Let me start off with one that's pretty straightforward. There are 3 vaccines out there: Pfizer, Moderna, and J&J. Do you have a favorite?
I usually tell people take the one that can get the quickest. You know, I think some folks would say, well, you know, the Pfizer and Moderna are a bit more efficacious, and that might sway some people toward those. On the other hand, it's a 2-shot process, and you know, Johnson & Johnson is just one infectious, and it's pretty efficacious. So I think it is a matter of personal preference, also a matter of availability.
Very good, thank you. This next question is a multi-part, very good question, or a series of questions. Do you see COVID staying in the population as a seasonal disease in the coming years? How severe do you think these surges might be, given the propensity for serious disease? Are you aware of therapeutics, say similar to Tamiflu, that might be in development?
Great questions. I think there will always be some baseline, hopefully very low incidence of coronavirus in the population. Will it be seasonal? Interesting question. It could be if the incidence gets high enough, it could be seasonal because it's transmitted through a respiratory aerosol, and we're closer together during cold weather, and that's probably why flu peaks in the wintertime, because people are closer together. So it could be seasonal just based on cold weather and being closer together indoors. I am hopeful that we are going to have medication that will treat early symptoms and even people who have been exposed and perhaps were not vaccinated. There was a piece in the news yesterday about Pfizer has one such medication. I think it's a protease inhibitor. I believe that it's currently in clinical trials, and that would be a medication where if you had early COVID symptoms or had been exposed and were not vaccinated and were at high risk of catching it, that you could take that medicine just like we take Tamiflu today if somebody has early flu symptoms or lives in a family with flu, and that would prevent serious disease. So I am hopeful about that. We do have monoclonal antibodies today, so that people that get infected and symptomatic can get an infusion of monoclonal antibodies, which really mitigates some of the serious complications of the disease. But I'm very hopeful that we will have an oral medicine in the future that will be analogous to Tamiflu, if you will.
Very good. We have several questions coming through that are all along the same lines, essentially asking, how long do you think we will be wearing masks?
Yeah, I think that will last for a while until we get, I don't know if we'll have to have full herd immunity, but I think at least until the new case rate is significantly lower than it is now. I'm hoping that that won't last for a long time. It may be early next year, if I had to guess, but it'll be dependent on the number of new cases and risk of infectivity.
This next one is asking you to look into a crystal ball here, but they're asking, someone's asking, do you foresee a surge happening? Another.
I think we're always at risk of that. I think it will. I think this will depend on how quickly we can get our population immunized, get to herd immunity. The more people we have immunized, the less infectivity, the less transmissibility, the less likely we are to have new variants. And so I think it will be very much dependent on how quickly we get the population immunized.
Okay. We know the United States is doing a pretty good job of getting its population vaccinated, but that's not the case all around the world. The longer it takes, the more likelihood of variants developing. So, what do you have to say there in terms of, the variants that might be out there in the future, and, what's going to happen to get the world to where it's safe again?
Yeah, I think it's the same principle. The quicker we can get the world's population immunized and get to herd immunity, the quicker we can quell those new variants. It is a problem. If you look at new case rate around the world, it has actually gone up. We've seen what's going on in India and South America and Brazil and many of those southern cone countries in South America. A big surge related likely to the Brazilian variant, the P1 variant. We need to get vaccine out there around the world. I think our country is beginning to make an effort to contribute to that. WHO has a big effort to distribute vaccine globally. This will require greater production of vaccine, and that is beginning to ramp up. So that is the ultimate solution, to get as many people around the world as we can vaccinated as quickly as we can.
Okay, thank you. Not sure exactly what's being asked here, but the question is, do you think we will all have to eventually be vaccinated? And maybe that's a question about whether it could become mandatory once we get past the emergency authorization and into normal authorization. approval?
I think it would be optimal that everyone be vaccinated. That would be the optimal state. I think there are a lot of challenges around that, some of which are vaccine availability, some of which is vaccine hesitancy, some of which is different political views. But in the ideal world, I think everyone would be vaccinated.
This next question, President Biden issued a recent statement, pardon me, that fully vaccinated people can meet in an outdoor setting without masks. Do you think that's premature, or are we on the right track there?
I think we're on the right track, and that is the latest CDC guidance just out this week. You know, even before people were vaccinated, if you were outdoors and maintaining a social distance, people weren't wearing masks. You know, I have been out walking and exercising and not wearing a mask as long as I am socially distanced from people. Before I was immunized, I'm fully immunized now, and I really don't worry about it at all. So yeah, I think it's on the right track.
Okay, thank you. Let me just ask this question. In our cabinet meeting the other day, President, we had a pretty good discussion about Harris County is still in the red. They're still kind of saying they're red, and we were kind of talking about how that creates some challenges with Harris County still in the red. I know the county judge has some metrics she's looking at in terms of positivity rates, hospitalization, but at the same time, if you look at Harris County's narrative for red, orange, yellow, green, it says that by the time we get to where vaccination is widely available, you could be considered green. So again, trying to get the messaging and sort through that. You know where I'm coming from there?
Yeah, there are a number of different variables that go into that decision making. For example, the new case rates, for example, the test positivity rate, and we're still above the threshold that was set for those, and that's why we still are in the red. What I hope will happen is that as more of our population becomes vaccinated, our new case rate will drop, our test positivity rate will drop, and then we will move downstream in terms of the severity. Part of this is a little bit arbitrary, but you know, we still have a fair number of cases. We still have a significant positivity rate, and so I think we have to continue to be very careful.
And this last question is a good one to wrap it with, and it's, what would you say to a student or staff member, faculty member for that matter, who is hesitant about getting the vaccine?
Well, I would say I understand. I understand that many people are concerned, hesitant. I would tell them that every physician that I know signed up as soon as the vaccine was available. And we are very cognizant of the risks and the benefits. Every decision we make about treatment, about intervention in medicine has to do with weighing the benefits versus the risk. And I will say that in this case, it is a slam dunk that the risks of vaccination are infinitesimally small, very, very small. And the benefits are overwhelming, because regardless of your age, if you get infected with COVID-19, you may have serious illness, you may have long-term COVID side effects, and you may regretfully die of COVID. So it's a slam dunk in terms of risk benefit. I think people should trust the science, should trust the careful study that's been done of these drugs, of these vaccines, I should say, and think seriously about getting vaccinated, because the benefit way outweighs the risks.
Thank you, Dr. Spann. I think we're going to now wrap things up. This has been a great session. I've watched all three of them. They've all been wonderful, but I think this one, you know, having a guest who really knows what we're going through here in an educational environment, It's been wonderful. So we're going to move to closing comments. I think what you just gave us was almost a perfect closing comment. So I don't know if you want to add anything to that, Dr. Spann, but we'll go with you first, and then we'll turn it over to our host, Dr. Blanchard, for the final word.
Well, it's been a real joy for me to be with you today. I hope that what we have talked about has been useful. I want to end with a note of hope. I think we've been through tough times. This has been a difficult time, but there is hope. There is hope that by continuing our public health measures and by getting vaccinated, that this pandemic will resolve. So that's the good news. If you haven't been vaccinated, let me encourage you to do so. And it's great to be with you.
Dr. Blanchard.
I just could not agree more with you, Mr. Bradley, that, all three of the sessions have been, I think, just information rich, but today feels even more special. And it's largely because of you, Dr. Spann, and not only your expertise and your guidance, but your connection with us that makes it feel that the information that we're receiving here is of great value, and more importantly, that we'll take as close of heed to as we possibly can as we continue to move forward during this time frame. I can say on behalf of the larger University of Houston downtown community just how appreciative we are of your accepting our invitation to join us today. And it's been just really, really valuable information. Thank you so much. I want to say also to the campus community that, this is the third of our three-part series on COVID vaccinations as well as health and safety. I don't want you to think for one moment that we're just going to drop the ball on this. There's far more that's going to be coming. So please continue to pay close attention to the email communications that you will receive from us, as well as monitoring our websites. There will be other forum series that will be forthcoming, but also there'll be a town hall meeting that we'll be conducting as we get closer to both the summer semester as well as the fall semester, where you'll get a chance to see all of the work that we have undertaken to ensure that our campus is as safe as possible. Looking at all of the different notices that we're placing in elevators and hallways, in classrooms and offices, reminding people to ensure that they are staying as safe and healthy as possible by virtue of the protective gear that we want them to continue to wear, such as masks, such as the social distancing. So we've got a lot that's happening right now that I think that you'll be very happy to see as we are making sure that our overall environment will be as safe as possible. So stay tuned for that. We're also going to continue to move forward with offering opportunities for vaccinations right here at the University of Houston downtown. You heard Mr. Bradley mention earlier the relationship that we have formed with Methodist Hospital. They've indicated that they certainly want to return, again, not only to provide the second dose, but for new cohorts of UHD family members. And I say family members not loosely because of the fact that it can be faculty, staff, students 16 years of age or older who can bring along their own family members who meet that same age requirement and feel very free that you know that you will get the opportunity to get vaccinated right here in a safe community, another place that you call home, the University of Houston downtown. We also have outreach made to us by Walgreens as well as HEB, expressing interest as well in providing vaccination opportunities right here at UHD. So there's lots happening. We want to keep you as informed and connected as possible. And today was just another opportunity to do just that. So again, very special thanks to you, Dr. Spann. Thanks to you, Mr. Bradley, and certainly Dr. Liza Alonso, Mr. Sam Bible, and Mr. Richard Vera. These things don't just happen magically. It really takes the expertise of those that are also working behind the scenes that I've just mentioned their names of. Thank you so very much. We so appreciate you. Have a good day, everyone, and you'll see us again soon. Take care now.